Hi, greetings everyone, as usual. So I am back again. I wanted us to discuss briefly the healthcare system itself today. I believe as a nation, like as a people in South Africa, if we truly understand the healthcare system, we also hold some power to make things change or to be the change we want to see. It starts with us, and then we will be assisting the policymakers. We will be assisting the government to actually action the changes that we want to see or that we recommend. But we need to first understand the basics and what power we hold and what role we have. Then we can carry on. So a healthcare system in South Africa is structured like this. We have primary healthcare, secondary, as well as tertiary, right? Good primary healthcare, we're talking about local clinics, talking about general practitioners, we're talking about healthcare facilities, the CHCs, yeah. And then we secondary healthcare, we're talking to the district hospitals. Even the primary healthcare hospitals, level 1 hospital, they are in the primary healthcare. Secondary healthcare, we're talking about level 2 hospital. Then level 3 being regional hospitals and highly specialized hospital and academic hospitals, those are tertiary healthcare. So first things first, our healthcare system is divided into these three. We have primary, secondary, and tertiary. And our primary healthcare, each of these healthcare levels have their role. So you angeke uthi uphethwe iflu noma uphathwa u-STI uye qonde straight Steve Biko. That is tertiary healthcare because it's a regional hospital, it's a tertiary an academic hospital. So there are things that are managed at primary healthcare, there are things that are managed at secondary, as well as the things that are managed in tertiary healthcare. And part of the mess we see here as a city, public sector is overcrowded, our healthcare workers are underpaid and worked and stuff, is because us as the people, we just show up anywhere and forced to be seen anywhere because of the frustration, sometimes the lack of knowledge, sometimes we know that the resources we need to be treated, really they are where we want to go. So there's no point in going to the clinic because you know abanayo test to start with, abanayo this treatment to start with, so you just gonna on the straight where you want to go. Can't that also pose some burden kuleyo system level oyakuyona, because it's not supposed to be like that. But I don't blame you, it's not entirely your fault, Akir, it's a fault of the healthcare system. So let's quickly reflect again. The primary healthcare system, remember, is in a hierarchy at the below. So according to this design, most people need to be seen with primary healthcare system. The primary healthcare system is the backbone of the healthcare system itself. If the primary healthcare system is on point, is well empowered, is strengthened, is strong enough, it prevents more people to be seen with secondary and tertiary. So a primary healthcare system is supposed to see majority of people. Then the second majority of proportion of people must be seen as secondary, but tertiary healthcare, ideally, it's not supposed to be seeing majority of people. Abantu abaningi, they must be seen. The first point of contact with the healthcare system must be primary healthcare. So again, let's look at on my left now. In primary healthcare, normally you get services like immunizations, family planning, antenatal care for pregnant women, treatment of common diseases, in general, common diseases, infectious and non-infectious diseases. Like certain chronic diseases as well. I just mentioned that. And then if any condition or a disease is not managed or it's beyond its scope, say primary health care, maybe some more complications, or you are recurring above its scope or normal ability of healthcare professionals agu primary health care, then they refer you to the secondary care. Secondary care nayo in a scope sakhona, in case you have something that is beyond their scope or beyond their ability, they are to refer you to tertiary care, to higher care. So this is the hierarchy that I need everyone to understand first. So with that being said, the issue why sihlanga in South Africa kugcwala ezibhedlela zonke, people go without being referred, others primary healthcare facilities, they end up referring things that are not supposed to be referred, cold cases and things that they supposed to be managing, is because it's not always in the high skill, which they are not skilled maybe to manage things. Sometimes people have the best skills, but they don't have resources and equipment yezinto ekumele bazisebenzise to manage those diseases, and they don't even have to start with passion a lot about tests, the point of care tests. Like umntana makeza nge-flu, we know now it's a flu season, but it's worth to know which flu is it, which virus is causing the flu, so that you know ukuthi is this a high risk patient also fall into severe disease and we're probably going to lose them, or is something that they can handle by themselves. So it's important to have a point of care test in terms of flu, to know which flu is it, how severe it is. Do I need to send to hospital? Does this baby need hospitalization and treatment, or this baby can be taken back home? STI, we need to know which type of STI is it, because if I'm not treating it accurately, treat us syndromically or empirically, just to suggest if the symptoms are suggestive of this STI, therefore I'm giving overall this treatment, I may be over treating that person or mistreating the person, but definitely I am contributing with antimicrobial resistance. We know that most of the antibiotics, they're no longer responding to the bugs because of misuse and overuse of antibiotics. So these are problems that we encounter due to lack of accurate tests or screening tests. So in passion, primary healthcare, I remember Dr. Aaron Mzwaledi, when he first came as a Minister of Health first time, he spoke so strongly about restructuring and re-engineering of a healthcare system, particularly re-engineering of a primary healthcare. We need to strengthen primary healthcare, because if our primary healthcare is strengthened enough, it does exactly what it's supposed to do, we won't see influx that we see above them with tertiary and secondary care. But now we are in this mess. We see all these type of diseases. Everyone is dying from diseases they're not supposed to die. Even the preventable diseases, even the avoidable diseases, people are dying from them so much in masses because we don't have a very strengthened or optimum primary health care. Primary health care, it's the first point of care. The bigger role in primary health care, it has to be preventing the diseases. We need to stop people from going to hospitals, which we're not doing at this point. We need to make sure that people are staying healthy and alive. We need to not wait for people to come to the hospital or to the clinics, because now we are curative care, waiting for people to be sick. We need to go look for the people and keep them healthy. We need to go to the people, look for diseases, stop them as early as possible. That's prevention and disease control. We need to, in primary healthcare, talks largely on disease control, preventative care, and health education, because those are the things that keep people away from the clinics, away from the hospitals, and keep them healthy and give them power to control their own well-being, to make sure that they stay healthy longest. Signs and symptoms, or if they have like early signs of diseases, detect as early as possible through screening tests and manage them as early as possible, so that we don't get to have everyone coming already sick to the hospital. We need to have a good primary health care so that it can stop people from coming to the hospital. The way we think, we know that the leading cause of death in South Africa among women, also breast and cervical cancer. We have diabetes as well. We have uncontrolled hypertension and heart disease and obesity. All those things talks to the failure of primary health care in controlling those diseases, in detecting them, in managing them early. And it's no one's fault. I'm not blaming anyone at this point. I'm just raising awareness and advocacy and stimulating conversations around primary health care, and that everyone has a role to play. We all need to prevent diseases. We all need to be on guard and watch out for diseases. So ideally, with primary health care, we need a decentralized health care, whereby the classical example, mobile clinics or the community healthcare workers, we have door-to-door where they go and ensure everyone is safe, everyone is healthy, and screen the disease and help those that are on treatment to comply and to adhere to treatment. We need to be going to the communities. And the country that does best in South Africa, my community healthcare workers, they need to be working closely, obviously, with supervisors. One of our countries like Cuba and Rwanda, they have the best decentralized care. Hence, like, even the quality of life is good over there. They have very low mortality rates, infant mortality rates, maternal mortality rates. And the life expectancy is well and good as well. Everyone lives healthy because they go into the communities and bring the services to the communities, to the people. I believe it's the only way to achieve universal healthcare coverage, because that's how we're gonna, we need part two. we need part 2.